Welcome to the HiFLEX Health and Performance Podcast. I'm your host, Dr. Chelsea Smith, here to guide you through all things physical therapy and whole body health. At HiFLEX, we believe the Almighty God designed us to move, heal, and thrive. Join me as we dive into pain relief, post-surgical rehab, life lessons, and key insights I share with my patients every day. Let's move better, heal stronger, and live fully. All right, welcome. Episode 10. Today, we're talking about dry needling. So this is a favorite modality of mine. Myself and Dr. Sarah Peterson both utilize this pretty regularly. It obviously depends on the person, depends on the case, what we're working on. But as far as modalities go that can impact pain and muscle activation and things like that, I just haven't found anything that is faster or more effective, honestly. And again, it just depends on the person and how they respond to it. But I love it. I utilize it often. I have a lot of people that seek it out specifically as far as like recommendation from word of mouth coming to our practice, and wanted to give an overview of it. So what is dry needling? So I get a lot of questions on like, what is dry needling versus wet needling? Why is the word dry in there? And the very basic answer to that is that dry is a solid monofilament needle that does not inject anything. So it's a clinical treatment that utilizes a very small needle placed into a painful soft tissue or not painful soft tissue. We'll go over that in a minute too. And a wet needle is something that injects. So think of anything like a shot or injection. So dry just simply means it does not inject at all. It's solid. Wet is hollow and it has liquid in it. So dry needling in general, the placement of the needle is based on the patient's unique evaluation findings to directly address their pain and dysfunction. The needle used in dry needling varies in length, and it can also vary in gauge. And when I'm looking at different needles and stuff, I typically, I lean a little bit more towards the thinner ones. Every now and then I go towards, I don't even want to say thick because they're so tiny. It's like glorified fishing wire, really. But depending on where I am going, if they're too thin, like for example in a glute or in a quad or just a really dense muscle, it's just too hard to get the needle inserted the way I want because it will bend. They're that thin. And so I might pick a little bit denser one, we'll call it that. What makes dry needling different in our practice? So Sarah and I are both trained in a style called Integrative Dry Needle Therapy. We got certified through, it's called Integrative Dry Needling, but Dr. Ma's Integrative Dry Needling specifically. And I love it. I'm biased, obviously, but it utilizes an advanced assessment technique to evaluate the status of your nervous system. And it's a whole body approach. So it's not just, ouch, I hurt here, put a needle here. It is treating the entire system, including spinal referral areas, nearby peripheral nerves, and also symptomatic spots. So there's always 3 points. So that's a big thing that I always educate my patients on is, what's the difference? They might have had dry needling before. They've heard that we're different. They want to know what that means. And I think a lot of it is it's just the brain. It's the logic behind it. It's the approach to it. So as an example, let's go over those 3 points that I was talking about. So I'll just use a very general shoulder or butt cheek pain. Let's start with shoulder. So if somebody comes in to me and they say, hey, I have pain in my right shoulder. Maybe it's out in the delt region, like out there on the side. Maybe it's in the back. Either way, where my brain goes as a clinician in general, and specifically with dry needling, is, okay, what level of the spine innervates the shoulder? And the shoulder is always going to be C4, C5, generally, as the primary drivers of that area. So I'm never going to just treat the shoulder, even with other modalities like joint mobilizations, things like that. I'm going to work on the spine because that's where all the signaling comes from. So the brain sends a signal that says, hey, this body part needs to move. It goes through the spine. It exits at a certain level. That level innervates that part of the body, so the shoulder, tells it to move. And then on the opposite side, if it feels pain, something is not feeling good, that signal also travels up through the spine to the brain that says, hey, ouch, this hurts over here. So if you are not including the spinal cord and you're not including the brain and things that interpret what you're feeling, you're missing out on a huge component. We don't have to get into the nitty-gritty of parasympathetic and sympathetic, and central nervous system and all these things. Just know that obviously you need your brain and you need your nervous system for the show to be run. The nervous system is king. So I always treat spine. So if I'm going to treat a shoulder, I almost always treat like C3, 4, 5, and 6, maybe farther down, depending on what's going on, maybe C7 too. Then what I'm looking at is, okay, what main peripheral nerve makes the shoulder work? So when we're looking at those things, your suprascapular nerve, and again, no test on Monday, but your suprascapular nerve is all things motor, so makes it move for the whole shoulder joint itself, the glenohumeral joint, and also sensation to the shoulder joint and the AC joint, which is very interesting because a lot of times I think people just are very in a mechanics-only mindset, and that's, mechanics are incredibly important, but if the signaling going to that area and the muscles that move and control the mechanics is off, you can try to work on mechanics all day long, and you might not get the full desired outcome because the signaling is not optimal. So I'm always going to needle, in this example, over the suprascapular nerve. I'm also going to needle. There's a spot on the back of your shoulder called your quadrangular space and your triangular space, and that's where the axillary and the radial nerve come out on the back of the shoulder. If you can kind of envision where the tricep comes up and it crisscrosses with the rotator cuff musculature on the back, it's a common place that gets very irritated and can make pain out in the delt, pain that can go kind of from the shoulder down the arm. So I needle all of those pertinent neural points, and then I'm going to needle where the patient says, hey, it hurts right here. So that way we get just a full system-wide response. We end up having a big impact on the central nervous system as well. Like if the entire system has just been sensitized, not only are we helping locally, but we're helping systemically. So that's pretty cool. Okay, the next question that I get very commonly is, what am I going to feel when I get dry needled? So I typically throw out a stat that we learned in the course of, 8 out of 10 people don't find it to be painful. It's not that they might not put it in a category of uncomfortable or weird or something that maybe you wouldn't classify as positive, but it's not necessarily generally categorized as pain. And usually the worst round of it is the first one because your brain's trying to figure out, what in the world am I feeling? This is a brand new sensation, is something deep that I'm feeling. And sometimes people don't feel anything at all. So there are, that leaves 2 out of 10 that are going to find it to be more of a painful experience. A lot of times when we screen these people anyways, a lot of other things are also interpreted as painful. So a lot of different kinds of soft tissue, deep tissue mobilization, things like that are also perceived as painful. So most people, though, are very surprised by how not painful it is. Otherwise, they wouldn't keep coming back for it. So a twitch. You might feel a twitch when I am near an area that has an increase in, we'll just call it neuromuscular excitability or tension. I always use the example, think of it like static electricity. If you build it up and you finally touch something that offloads that electricity, you feel a little shock. Not that it's painful, but just, oh, whoa, shock. So if you have an area that has had a lot of neural sensitivity going on or a lot of just muscle irritation, when I get near a spot like that, a lot of times without even moving the needle much, not fast or anything like that, it will just twitch. There's some schools of thought that they're really looking for the twitch. They're trying to force the twitch. I tend to find that people find it more comfortable if I don't have to force a twitch. It depends on the case. If I feel like it's very necessary or that it's going to get us a good outcome, I'll do a little bit of moving the needle more to elicit a twitch. But a lot of times, just a slow moving needle, it produces a twitch anyways. We think of that kind of as a reset button. So think of it again like the static electricity. It's offloading, it's depolarizing the neural field in that area. And they've done studies on these things. So if you're a research person and you want to read that somewhere else, let me know and I can send you some stuff. Most common sensation people feel is a dull ache. That indicates that your clinician is stimulating tissue that needs it, because super happy tissue, really it doesn't feel almost anything. And obviously if you're coming in for needling, unless it's performance-based needling, you're generally already experiencing some level of discomfort. And so it tends to be a good thing as long as it slowly reduces and doesn't increase. So most of my patients, between 10 and 15 seconds, it's totally dissipated and they don't feel the needle at all. They're like, oh, it's still in? I had no idea. Sometimes burning is a sensation. It's not as common, not as enjoyable, but there are little nerve fibers on your skin called C fibers, and it's just a pain sensor. And you can't see them. There's no way to know exactly where they are. So if a needle poke feels stingy or burny, I always tell people, let me know. I'll just immediately take it out. We'll rub the area real quick, and we'll needle somewhere else, and it should fade. There's no lasting issue from it, but that is a possibility. Tingling, so that just indicates that we're close to nervous system tissue, which is safe, and many times it's the goal in order to reduce inflammation and ultimately alter pain levels. So a lot of times, particularly in butt cheeks, if I am very close to the sciatic nerve, people will feel some tingling down their leg. They might be like, oh, it's weird, I feel that in my foot. And it should dissipate pretty quickly as well. They have done some studies like trying to actually poke a nerve, and they're just so dense, and they have a slippery sheath on the outside of them, and these needles are so thin that typically the nerve just moves out of the way. Same for vascular system and any of the blood system. It just tends to move out of the way, and you'd really have to pin that tissue down and just try to repeatedly get after it. So that's not typically any kind of a concern for any negative outcome. And then I would say most importantly, reproduction of your pain. So a lot of times, and why I love a needle is because where signals are coming from, it's very deep. And if I'm just going to sit there and like shove my thumb on something to try and reach that tissue to make any kind of change, that's also not super comfortable to have something dug around on. And a needle can get right to it. And when you get near that area, the needling can reproduce your specific pain, and oftentimes people are like, whoa, that is crazy. I'll be, let's say, somewhere in the neck, if we're going back to the shoulder sensation, the shoulder symptoms, and they will feel their pain deep in their shoulder, even though I'm not touching their shoulder. Or I'll needle the shoulder, and they're like, that is it. That is the pain that I'm feeling. So it's nice because it lets us know that we are in the right spot. It's just kind of a guiding point of, yep, if this is exactly what's reproducing it and where it's coming from, then it is easier to treat things and lets us be a little bit more accurate. So biggest thing I always tell people in the sensation world is you are the boss. Communication is key. There is absolutely no reason to sit through discomfort and pain that does not fade very quickly. That is not the goal of this. It is not a torturous procedure. So if something is more uncomfortable than you would like it to be, immediately say so, and we can either very, very tinily back out the needle just a little bit, and usually it changes quickly, and the pain is completely gone. So it is not one of those no pain, no gain, the worse it feels, the better your outcome. It should be a, maybe temporarily uncomfortable and then neutral experience. It should not be anything that is terrible. Okay, how can dry needling help? So there are a ton of benefits to dry needling because it manages soft tissue inflammation and it positively influences the function of your nervous system. So it improves blood flow because, we're inherently poking a needle through some tissue and we're making intentional damage or change. The word damage is kind of just a negative word, but you are causing intentional change to that tissue that is going to then increase blood flow to the area, which is going to tell the brain, hey, we also need to send in all the good healing cells. It's a good inflammatory response because in general, when something is wrong, the body should have an inflammatory response and it should resolve after that. It's when inflammation gets out of control or things are ongoing that it becomes problematic. Other benefits, release of tension in muscles. It really is crazy how fast it can reduce the sensation of tension because sometimes tension is just it's a protective strategy of the body. And when you can release that or to kind of do a reset, you'll feel an immediate difference. Decreasing pain, increasing range of motion, increasing muscle strength and activation. So it actually increases your brain muscle connection for like 2 to 3 hours. So improved muscle firing rates for several hours afterwards, and just improved function in general. So you can be sore. It can feel like a workout soreness sometimes. So I always tell patients, anywhere from 1 to 3 days, just like if you went to the gym and you made yourself sore, you might still be sore a few days later, but it shouldn't be progressively getting worse. It should be progressively getting better, and it should not feel like pain. It should feel like soreness, like that muscle has done something. I do find that my active patients get way less sore than my patients that are not currently active or working out. That's not always the case, but in general, if your muscle is not used to feeling sore in any capacity, it might interpret that as more uncomfortable than somebody who's very used to a sensation of soreness. Okay, the ultimate question that is always asked, is dry needling the same as acupuncture? And no, the answer is definitely not. It looks incredibly similar because the needle is the same. I mean, I'm pretty positive that the acupuncturist that works just the next door down from me, we use the same brand. We probably use the same lengths and gauges and things like that. But the logic is different. The brain behind it, just all the education is completely different. Now, there's going to be a ton of overlap because we're talking about the body. And there's, obviously both sides are going to know the anatomy. Both sides are going to know the neurology. But it is just a totally different mindset, basically. So acupuncture is much more rooted in Eastern medicine. I think the most common that I've seen around here is Chinese acupuncture. I do believe there's Japanese acupuncture. I'm sure there's other flavors of it, but very Eastern. And it applies principles such as meridians and qi, and those were developed thousands of years ago to treat physical, mental, and emotional pathologies. And hear me say, because I dry needle does not mean that I don't like acupuncture. I think we treat totally different. We might treat same things, and we also might just treat totally different things. Like, I am never going to advertise that I might be able to alter or speed up a labor process for birth. And acupuncture definitely has some protocols that, they claim can help flip your baby if it's breech, or can help initiate labor. Things like smoking cessation. It taps into just different energies of the body and does different things. Now, those are just two totally, specific examples, but they obviously they treat pain, they treat allergies, they treat visceral issues. So I would say they just tap into more, how do I want to say it? More of a visceral relationship to the body. So they might be doing things that improve overall health more. And then again, a lot of our points are going to be the same, especially when it comes to treating pain. So dry needling uses more of a Western medicine principle. And when I say the next line of things, it's not that acupuncture doesn't use them, but we base it primarily on neurology, physiology, and anatomy to treat neurophysiological pathologies like decreased mobility, decreased strength, pain, and function issues. But again, I've never met an acupuncturist that doesn't know their anatomy or their neurology. So when I say that, it's just that that's our primary. They know those things, but they are primarily looking at things like meridian and qi and energies and applying that to the anatomical and neurological pathways. So they are very, very similar. They use the same needle, but the ideology and treatment approach is very different. Now, I can say that when I have needled someone and then sent them next door for Brett, who is the acupuncturist, to needle them, watching, the palpation process is different. A lot of their needle placement is based on palpation versus a lot of mine is knowing where anatomy and neurology lives. Also palpation, but different. I'm not feeling for energy. I'm not trained to feel for energy like that. But when I look at the final setup, I'm like, hey, we might have used like 70% of the same spots. And some of them just might have different names. So I do not ever use a spot that is named an acupoint. I might call something like, this is the vagus point, the vagus nerve point on the ear, and they may have a totally different acupoint name for that. It's a bit territorial. There's been some legal back and forth on, especially in Tennessee, of acupuncturists trying to claim the entire use of needles like that, and say that dry needling should be taken away from physical therapy, and ultimately, obviously, that went back, and we clearly can dry needle. But it's one of those, I think a lot of people that come to me for dry needling, if they already do acupuncture, they're going to stay with acupuncture as a long-term health management because they love it and they find benefit in it. And I don't think it's just going to totally sway somebody to only do dry needling. But that's just my experience. I don't see a need for territorial things. I think the more we can all work together, the better. But yeah, so I treat a lot of conditions where people are getting referral patterns different places and pain down the arm or down the leg, and or just local spots. You can actually treat bruising and swelling, which is interesting. You just use a very, very, very thin needle, but you're basically just helping that body's inflammatory response. But I think it's fantastic. Like anything, It's best when paired with movement. It's best when paired with education and empowering language. The goal is not to have somebody feel dependent on dry needling of, oh gosh, if I don't get dry needled, I feel terrible. I have to do it. It is a very useful tool, but that's what it is a tool. We get plenty of people better that never, ever, ever have a needle poked in their body. And I think that speaks volumes. So education is key. Incorporating it into healthy lifestyle choices and movement choices is key, but it can just be very, very fast. It's a very fast catalyst for change. So hopefully that was helpful, educational. I do have an Instagram post that pretty much has all of that stuff already written out, so I'll probably just reshare that too, but hopefully you guys found that to be useful. All right, see you next time. Thank you for tuning in to the HiFLEX Health and Performance podcast. I hope you enjoyed this episode and learned something new to help you move, heal, and thrive. If you'd like to dive deeper into any of these topics, feel free to reach out to me directly at chelsea@hiflexhealth.com. Visit our website at www.hiflexhealth.com or connect with us on social media. Keep learning, keep moving, and keep healing. And I look forward to having you back for the next episode.